You're listening to What's the Difference podcast, a podcast about resilient women living our best lives with invisible disabilities. Created and hosted by Jackie Rosen and co-hosted by Cynthia Chang-Mintz, Sarah Patel, and Samantha Moore. To view the video version of this episode, please visit our website at whatsthedifferencepodcast.ca. You can also connect with us on Instagram or Facebook at What's the Difference Podcast, or on Twitter at PodcastWTD.
Welcome to another episode of What's the Difference Podcast. I'm your host, Jackie Rosen. We're joined today by our co-host, Sarah Patel.
Hi, guys.
And our special guest, Sehdeen Lowe.
Hey, everyone.
As the topic of anti-Black racism has become a bigger topic in the news, and it's a bigger focus now, we want to hear from Sehdeen about some of her experiences as a Black woman with a disability in hospital settings and kind of what we can all do to make things better. So, Sehdeen, you want to go ahead and introduce yourself? Tell us a little bit about yourself and your medical issues, and go ahead.
Hey, everyone. Once again, my name is Sehdeen Lowe. I run a podcast called Sehdeen Unbridled and a website. It's Sehdeen. It's kind of just based on the basis of loving myself now. Professionally, I'm a social worker and I work in a lot of these settings. So I will also bring my professional opinion in today as well as my personal opinion. In terms of disability, I have PTSD, a panic disorder, and what my doctor likes to call high functioning depression, even though it's not on the DSM-5. I also have a host of other health related issues that would fall under the term of a disability because of the way that they bother my life. Part of the thing I'll be talking about today as well is being pregnant with all of these issues that are going on and how medical professionals treated me as a Black woman and how even my friend who had very similar comorbidity was treated and she was white. So we'll be bringing everything in today.
We're so happy to have you on the show. We're glad that you could join us. And we know that you have a little boy in the background. Is that right?
Yes.
And that we're trying to keep him entertained while you talk to us.
Yes. So currently he's watching Cocomelon and he has a bottle. So for now, he's kind of okay. Let's see what happens.
We'll see how it goes. And you know what? Kids are allowed to scream on our podcast anyway. So it's totally fine if he starts screaming. He's welcome to.
You mentioned you are originally from Jamaica. Compare the way you were treated back home and here in the healthcare system.
So I came to Canada when I was 14. Wagwan, Badop. The medical system is two very different systems. So mental health is often not recognized in Jamaican culture. In any or most Black cultures, to be honest, we don't, if somebody says that they're depressed and they can't get out of bed, it's often termed as you are lazy. And I recently learned that laziness doesn't exist. It's not a thing that actually exists. It's either you're capable of doing something or at this moment, you're just not capable of doing it. So in our culture, again, often it's just seen as you're lazy. If you have mental health issues, often it is not paid attention to or given the service it requires or need. And mental health is look really bad. Like we would make fun of people and tell them they need to go over to Bellevue. And Bellevue, at the time, I don't know if it still is, was a mental health hospital in Jamaica. Like we would joke that we need to bring you over there because you're kind of cuckoo. Again, even people on the streets may have mental health issues and kind of just need support and help with that. They don't have it. And the infrastructure isn't set up to give them that mental health help. In terms of everything else, I think the hospital in the community that I grew up from, you only go there if you want to die. That's just my take on that hospital. It's the public hospital. And unfortunately, we were fortunate enough that my mom could afford the private hospital. So I tend to went to private care rather than go to public care. But that's like a whole different conversation in terms of like what healthcare is available. And Jamaica is considered third world country. So
yeah, I think like just a lot of cultures in general, just mental health is just not something that's talked about.
And I think we've gone over this too, is with with the pandemic and everybody feeling a very similar sense of isolation and all that. It definitely has come to the forefront a lot more in the media. However, the problem is that for those of us who always suffered from mental health issues, before the pandemic, it's like, well, what took you so long? Like, we've been dealing with this for years. It's only when it affects everybody that suddenly you're like, oh, well, we need to make it a bigger deal and we need to provide free therapy for people. And well, why couldn't you do that 20 years ago when I was 16 and freaking out about everything? And why was it then we had to hide it? Because you have to look strong, you know?
Exactly. And Brene Brown often says that vulnerability comes from just owning our story and owning what we're going through at that moment, right? So when we're told to just suck it up and be strong, part of me being strong is telling you that I'm struggling. It took courage for me to say that I'm struggling. And I need you to validate the fact that I just said that I'm struggling and be present here with me in that struggle. Rather than tell me, I'm Christian, so pray about it. You're not praying hard enough. Depression is a demon.
Yeah.
How do you think you were treated or your experience has been here in Canada?
So something that wouldn't be available to me in Jamaica that was available to me here is I started therapy at 16, and therapy for me was free. At that point, it absolutely would not have been free in Jamaica. And I did do a bit of therapy there as well. I don't think there's a difference in therapists, that the trainings are pretty similar. But in terms of like affordability, absolutely, I had more access to support and help here than I did there. I believe there, my family could only afford for me to do maybe 6 or 7 sessions. And here at 16, I did like 20 or more.
Oh, wow.
And that was all covered. So again, that's a difference in access, as well as why I went to therapy isn't something that would have been paid much attention to in Jamaica either. And that in itself is like a touchy topic because 1 in 5 women in Jamaica, I believe those are statistics, don't quote me, but it's a very small number of women in Jamaica who have been raped or sexually assaulted. So the access that I have to that help here isn't something that they have there. And it became a very big thing in our community a couple of years ago, where they had to rally around people because 3 girls found out that they were being raped by somebody, all 3 girls in one family being raped by the same person as time went on. And the community really had to rally around them to provide them with support. And some of the backlash that they got because this was made public, it was on the news, was that people in their general vicinity kind of looked down on them, throw stones at them, tell them that they were being fast and that they were asking for it, and how now they had an upstanding citizen that is now in police custody and he didn't deserve to be there. And that was the first time in a long time that a conversation was being had about what was going on and how do we support these girls. At one point, the girls came on the news and said, one of them said, I want to kill myself. The way that people are treating me, I want to kill myself. And that continued to perpetuate the culture of silence that the community holds when it comes to mental health, when it comes to abuse, especially against women and young girls. And often this is a generational thing. So for that to happen to me and for me to have access to it, it isn't something that I would have had access to while living in the Caribbean.
And something I want to just mention to our listeners, because we do have listeners in the US. So in Ontario and in most of Canada, psychiatrists are actually covered by public health care. So if you can see a psychiatrist, that will be covered by your provincial health plan. However, if you want to see a psychologist or a counselor, depending on the type of counselor, you may have to be paying out of pocket. If you're working, you might get benefits and be able to pay that way, but there's different levels of care. So not absolutely everything is covered under Canadian healthcare, but psychiatrists generally are. So just something to let our American listeners and anybody else around the world know. So Sehdeen, tell us a little bit about your pregnancy and some of the complications that you had at that time.
I found out at 19 I wouldn't be able to have kids. A reason wasn't necessarily given to me by my doctor. Back then, he should have realized that I had fibroids, and that because I'm an African American woman, fibroids are generally more prevalent amongst us, but he didn't. He just kind of told me that I don't know why you can't get pregnant, and kind of left it at that. And I took that to heart at 19, and I was like, I want kids. So at the time, I was with my ex-fiance for like 4 years, I'm like, okay, let's try. And got pregnant twice, ended up having a miscarriage, and I kind of just chalk it up to me not being able to have kids. I'm like, okay, I can get pregnant, but for whatever reason, nobody could figure out why I couldn't carry past like maybe 8 weeks, 8, 9 weeks at the max. So for years, I kind of lived with that knowledge in my head. With my son, after like 2 years of celibacy, decided to do rendezvous one day, and voila, we had a baby. Immediately, there were complications. So I found out in like May 6th of 2018. Went to the ER that day because I had been cramping the whole entire week. We found out that I had a 16 centimeter fibroid, about as big as a bowling ball.
Oh, wow.
I had 5 fibroids at that time. So a bowling ball, cantaloupe, grapefruit thing, and an orange. Those are the three biggest ones that were affecting him. And there was two others off somewhere in the abyss that weren't causing as much problems. So immediately doctors told me I would miscarry based on what I was presented with. Again, at that point, I was super high in my faith. And I'm like, yeah, no, we're not having that. That's not what we're doing. Um, and I kind of kept my faith throughout my whole entire process. My faith really helped me through. But right off the bat, I was termed as high risk. I was obsessed with midwives then. And I'm like, no, 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 I'm not high risk. I'm not accepting that upon my life. And I had a midwife. Things were kind of smooth sailing. So that was 4 weeks. I found out like 3 weeks something that I was pregnant. So like 4 weeks until like 8.5, now I'm between 9 weeks. I thought I had a UTI. Went to the doctor. They gave me some meds for the UTI, but they didn't check further. Turned out that I had a kidney infection. And that kidney infection kind of led to sepsis and getting into my bloodstream. And I went to the hospital because I kept on throwing up. And at first they were like, oh, it's just a part of your pregnancy. I'm like, no, it's not. It's not. I know. I know. This is also a little bit of TMI, but I would pee and it would look like the darkest color you could ever think of in the face of the earth. Almost like there was blood inside of it.
Yeah, that's an infection. That's a really bad infection.
So finally, they did some tests on me. They realized that I had a fever. They realized that I was sepsis. My white blood cell count was out of the roof. They're like, yeah, it's not okay. What followed after that was 4 days of me violently vomiting with no medication that they gave me would work. Like my nurse felt so sorry for me. They could fix what was wrong. So we found out that I had hydronephrosis, which just means that my kidney was swelling. Why I had hydronephrosis was because one of those fibroids was pressing on the track from my bladder to my kidney. And that particular, I think it was my right kidney, was just swollen from backed up fluid not being able to get through. They could do a surgery, but if they did the surgery, I might have lost the pregnancy. And they're like, we don't know if you doing the surgery will even help based on where that fibroid currently is. So they kind of left me alone for a couple of days. And then again, I had to advocate for myself because doctors seem not to listen when they're like, oh, you're throwing up because of your pregnancy. And I'm like, no, I'm not.
Nope.
No, I'm not.
Yep.
That's not the type of pregnancy I'm having. I get nauseous, but I've never thrown up. I could not keep anything down for 4 or 5 days. Literally nothing. Until they finally called an OB in. They called like 2 OBs in, and both of those OBs decided that they do not want to take my case. Finally, they called in the big guns. He is the chief of the OB department, or the head of the OB department. And he comes in, he's like, okay, I'll take your case. So finally, he got me on
They're like, thank you.
Exactly. He ended up being a godsend throughout my whole entire pregnancy. He's like, I'll take your case. And finally, he gave me some medication that kind of helped with the vomiting. And we're able to go home within like 48 to 72 hours after that. So I spent a week in the hospital between 8.5 weeks and 9.5 weeks. So at that point, he's just like, you're high risk. You're very high risk. I'm like, okay, still not paying them any attention because I'm just like, no, I'll be fine. This will even itself out. 14 weeks, I started having contractions. And they're like, we may need to sew your cervix shut.
Oh my God.
I'm like, okay, still that high risk though. Still that high risk though.
I admire your determination.
Me too. 16 weeks, something else went wrong. One of the fibroids started twisting it around itself. I spent like 24 hours in the ER, them just giving me pain management. And at that point, I was put on morphine. I was sent home with actual morphine tablets because they're like, this is just going to continue happening throughout pregnancy, how big the fibroid is, and that the baby is also growing. So I should also add that like by 4 weeks pregnant, I was already measuring 19 weeks pregnant. So I was measuring way ahead from the beginning. Around 18 weeks, I started bleeding out of nowhere, like no explanation, no anything. At that point is when I took it serious and I'm like, okay, you're high risk. Because they couldn't explain to me why I was bleeding, what was happening. Again, spent another, I think, 24 to 48 hours in the hospital. The ER knew me. I was a freaking flyer by then. The nurses knew me. They knew me by name. I know them by name. They see me coming. They know. So at that point, we had a urologist. There was also issues with my blood that they couldn't figure out. I had an internal medicine doctor. I had a hematologist. I had my OB. I think there's maybe one more doctor that I'm missing. And I saw like regular pregnant person. You can tell me, Jackie, in the beginning, you didn't see your doctor every week or every 2 weeks.
Well, I'm also high risk, so but then again, I'm pregnant during COVID, right? So I spoke to the doctor about once a week on the phone. I have actually 5 doctors on my care team right now, and I do have quite a heavy care team. However, I'm considered what you would call low risk, high risk, because I haven't had any complications, knock on wood, no complications at this point, and they've been monitoring my heart condition, and so far there's been no changes in my heart that signify any danger. So so sort of like you, I had a lot of doctors, but then we had the COVID thing, and that kind of made it all balance out so that yes, I was speaking to like 5 doctors on the phone, but I wasn't going in to get any examinations or anything.
Oh, so for me, I saw my OB every 2 weeks. You're not supposed to see your OB every 2 weeks until you hit third trimester. I was seeing him every 2 weeks from second trimester. And then we continued on, we settled out. I got to about 24, 25 weeks, and he measured my tummy, and I was measuring 42 weeks. And he's just like, I'm going to stop measuring you at this point. We're not going to do this. And I'm only assuming that was because I was stressing him out in terms of I'm measuring so far along. What if I'm going to go into labor early? All of that. So he did just, at that point, he did not want to know what I measured because it's just like, no, we don't want to know all of that. And I went into early labor at 30 weeks. And then I was put on complete bed rests because up to that point, I was on from 18 weeks to 30 weeks, I was on partial bed rest. So modifications at work, etc., but I didn't need to stay in bed. At 30 weeks, I went on complete bed rest, and I was told that if I was walking at like 5 kilometer speed, I need to walk at like 1 kilometer speed. We need to keep this baby in for a couple more weeks. Actually end up staying in till 39 weeks. You can hear him behind me right now. But yeah, so that was my pregnancy. It was a lot of doctor visit, lots of trouble. I think I gave my doctor gray hair in the end of it. I remember that the last week was around Christmas because I delivered January 9th. So it was around Christmas. He's supposed to be on vacation. He was emailing the hospital from Turkey. He was in Turkey, emailing the hospital from Turkey, trying to figure out if I made it through the week and planned everything that had to do with my surgery. My surgery was supposed to be about 4 hours in total. Hopefully that's not too loud. About 4 hours in total, and it took them like 6 because I had 3 surgeries in one.
Oh, wow.
They had to put blockers in my hip to stop me from bleeding out. Then they did something else and all sort of things. And yeah, it was just a whole work. In the end, I did end up having bleeding issues and ended up in the ICU for 36 hours. And that was my very high-risk pregnancy. Throughout that, I noticed, one, doctors don't listen to you. and that pisses me off to no end. I feel like I know my body more than anybody else. You should listen to what I'm telling you.
Mm-hmm.
Secondly, I'm also highly overweight. For those of you listening and not watching, I had one doctor tell me to only gain 17 pounds in my pregnancy, where to that point, I hadn't gained anything. I actually lost 30 pounds and I wasn't eating any differently or doing anything differently. That's just like somehow my body and my hormones are just like, we'll lose weight. So it was like a up and down sort of situation. And doctors annoy me. That one particular doctor that told me to lose 17 pounds, my OB office actually knows if she's there, I'm not coming in. And that's where advocacy comes in, because if I wasn't advocating for myself and being insistent, especially with that UTI, I went back to the doctor like 3 times and to the ER twice before they realized, oh shit, something is actually wrong.
It's so interesting that you point that out, Sehdeen, because right now, as some of the listeners have listened, like I'm going through my own journey right now, since I've got into a motor vehicle accident, and I've learned, especially in the last couple of weeks, I've been having to do a lot of advocacy. And one thing is that I have one doctor that's telling me to change my diet, not knowing my history, not knowing what my diet is like, not even asking me. And I've kind of been on the opposite. I've always been underweight. So I'm always been told to put on weight, and it's telling me to go on a plant-based diet. So
a plant-based diet doesn't necessarily solve all your problems depending on who you are. The one solution helps all is not a thing. And I'm tired of hearing that.
don't worry, Jackie, you know how I have felt in the last couple of weeks. And one thing, Sehdeen, you did point out is like, us individuals that are facing any sort of medical issues or medical conditions, we know our body best.
Yes.
So when our voices are not being heard, and when we're trying to tell them like, no, I know my body, I've been through ERs and I've been through numerous doctors, I know when something is not correct. So you need to listen to me.
It's war. It's absolute war.
Exactly. Even with that, so there's a study that was done by an English doctor. If you search it up on TED Talk, you'll find she said she noticed something within herself. She noticed a bias that if a Black person came in with heart issues, chest pain, etc., she automatically would think of cholesterol. You need to lower your cholesterol or high blood pressure, something like that. She wouldn't think heart attack. And it wasn't until she noticed that bias within herself that she saw that same bias around those around her. If a Black person comes in complaining of any sort of pain or issue, they're not going to pay attention to it as quickly as if somebody with a fair complexion, white person, come in and say, oh, I'm having chest pain. And another study also showed that some doctors, not all, believe that Black people feel less pain than white people. So again, as a Black woman with mental health issues, sometimes my mental health gets blamed. And I'm like, no, it's not in my head. Currently, something I'm fighting and experiences as we're talking is often my hands get swollen, my feet get swollen, and I will gain 20 pounds in a week. And often I'm told that it's my diet, it's because I'm overweight, it's this or it's that. And I'm just like, but you seem not to understand. I gain 20 pounds in a week. That's not normal. I don't care what I'm eating. There's no way I can gain 20 pounds in a week. And my hands are visibly swollen. I can't close them. Sometimes opening them, I can barely open. Like right now, they're not even as straight as they could be. And nobody knows why. And they're not taking the time to do the in-depth tests that they need to do. And I'm constantly asking myself, is this because they have this bias in their head that Black people don't feel the same pain the same way? Or is it because I'm overweight? I had one doctor told me, I love her to pieces, because she's like, don't you ever blame your weight ever again, because they actually thought it was something with my heart. And I'm like, oh, I just thought because I'm overweight, like I'm experiencing shorter breath because of that. She goes, no, don't ever do that. And then I have another doctor who immediately tells me, we should refer you for surgery so you can lose some weight. So him, I ignore his calls.
Yeah.
But I think a lot of times when people walk into the emergent, especially if they are coming from a colored background, or they are just not accepted or treated on basis. It's just like, oh, they're just looking for an excuse for medication.
Exactly.
I'm not a Black woman, but I do come from a colored background, and I've been in the emerge on many different aspects, unfortunately. And I know family members, and it's always just been like attention seeking. I've gotten attention seeking. She's just looking for medication. I was having an anaphylactic reaction about 2 years ago when I was having a gluten intolerance issue. The paramedic is telling me I'm not having an anaphylactic reaction, and he knows, apparently, quote unquote, he knows what an anaphylactic reaction is because he's allergic to peanuts.
Oh God.
And he's like, you're not having one because you can still talk to me. You just need to regulate your breathing. And I'm like, I'm trying. And then I go into the emerge, and a nurse or someone says, is she a mental health patient?
Wow.
Because I was sitting there, my tongue, and I realized that sometimes with allergic reactions, you're not always by the textbook.
Yeah.
And I was sitting there, my tongue was sticking out to the side. I don't know that my tongue was sticking out because I had no feeling on my tongue. And I'm sitting there itching my arms because I'm breaking out in hives. And I'm like, and they're saying, I swear to God, if I could, like, that day, if I was like in the right headspace, I was ready to snap because I'm already on a stretcher. I'm being brought in by ambulance. The paramedics don't even believe me and not taking me seriously. And then you have a nurse telling me that, oh, is she a mental health patient?
Yeah. And here's the thing too, is that even as a woman, let alone being a woman of color, even as a woman, you're already doubted. So when I ran into my big UTI 9 years ago now, that ended up turning into vulvodynia and a little bit of interstitial cystitis, nobody believed me when I was screaming in pain. No one believed me. They thought, oh, she's just exaggerating. It's all in her head. And I was going to the emerge every weekend with terrible pain in my bladder and in my vagina. And I was just in agony screaming. Even morphine didn't help. And it took 10 months. It took 10 months to diagnose. And finally it was like, okay, it is a chronic pain condition. And I was like, I've been looking it up. I found the answer myself.
Thank you.
A month after this all happened. And they kept putting me on antibiotics saying, you have another UTI. But I never did. I only had the first UTI that caused nerve damage. And I had the answer online in March, a month after it first happened. And then it took till December until I got a doctor to say, yes, that is what you have. And once I knew what I had, it was like light dawned, and it wasn't even as bad because it was like, I legitimately have a diagnosis now. Now I know how I can move forward. And it was, as soon as I got the diagnosis, that alone diminished the pain because I didn't have the stress of trying to figure out what it was anymore.
Or the stress of knowing that when you go to the ER, you will not be believed and you will not be treated with common decency. I feel like that affects your mental health and causes its own PTSD and disability issues. Because not being believed when you're chronically in pain, it's like, it's so difficult. I can't imagine. Like, I absolutely cannot imagine. Even for myself, I got myself diagnosed with PCOS and endometriosis. I literally went into the doctor with all my sheets printed out. I started my period early at 10 years old, and I've had the most painful periods my whole entire life. Like, I mean, when they come around, I can't do anything. My back is hurting. I can't walk. I need to have a hot pack on my tummy. I'm highly medicated. Like, my medication, my ex who has sickle cell, that's what he takes for pain. And at one point when Oxycontin was on the market, I was on Oxycontin on my period.
Yeah.
And when they took that off the market, I'm just like, what am I supposed to do now? You don't want to prescribe morphine to me every month. And they're like, oh, you're not in that much pain. And I'm like, who are you to tell me my pain levels and pain scale?
Exactly. My doctor's automatic response is because I have really severe, actually, period cramps, and even after something I get really bad cramping in my ovaries and things like that, and anyways, it's all over the place. But they were like, well, just go on birth control.
Thank you. Why are we trying to cover up the symptom rather than treat it?
It's like, yeah, I'm like, I'm not going on birth control. That's just the answer of going, okay, well, then take Midol. Well, Midol doesn't work for me. I've done Advil. So then, okay, like I'm obviously on prescribed medication now because I said, no, I'm not going. I don't have any reason to be on birth control, and I'm not going on birth control to mess with my hormones even more when I'm not even having a proper period.
So you mentioned some of the experiences you've had as a Black woman in a hospital setting. Are there other experiences that you want to share with us that were particularly like, oh my goodness, I can't believe this is happening?
Hospital setting, I've never really had so much as my color being brought up. Thankfully, I've had a lot of at least colored nurse or Black nurses, and they kind of help with the advocacy. For me, I find that I have more advocacy from a person of color if they're my nurse than I do from a person not of color. The treatment and care to me is extremely and widely differently. Like even with my delivery with my son, my first nurse, I was in the hospital for 4 days. Was it 4 days? 5 days. And my first nurse for the 3 days was a Black woman. And the care, the effort, the extra information, all of that, she gave to me and not my other nurse. Once that nurse left after her 3 days, the nurse that I had after that didn't show as much interest, didn't show as much care. I think the one thing she did one morning, my blood pressure spiked really high. And that was when I saw the most care from her during that time being on the maternity ward. And even trying to explain to that nurse that, hey, generally, my blood pressure never passes 120. In my whole entire life, I can tell you on one hand the amount of times my blood pressure has passed 120.
Yeah.
And I'm like, if I have a normal blood pressure, my blood pressure is high. Eventually, my OB had to come in and tell them the same thing. Like, if you see her at normal, something is wrong, start monitoring her a little bit better. Above normal, something is really wrong.
So it's funny because mine is the opposite. I'm kind of in the low category, like low normal. And so when I was going through this anaphylactic reaction, my heart rate and my blood pressure was the average normal, but that is high for me.
Yes.
And I'm trying to tell them throughout this, I'm like, normally my heart rate is around anywhere from 59 to 65. So the fact that it's like at 80 or 90, that is high for me. Through, the obstructive breathing that I'm having. And they're like, no, that's normal. And I'm like, but I know. I go to the doctors all the time. I know my blood pressure is always around 60 to 1, whatever it is. It's never in the one, it's never like a low or high. It's always on the lower side. But I'm like, what you guys are seeing is normal, but it's not the normal for me.
I will tell you guys a joke. Went to the doctor once. My blood pressure was like 88 over 50 something. And my nurse was freaking out just a little bit because it's below 90. And like my pulse is super low and etc. And I'm like, oh no, I'm fine. She goes, you don't feel lightheaded, you don't feel dizzy, you don't feel anything. I'm like, no, I'm okay. She goes, but that's not okay. So this girl literally went and got me food, got me crackers.
At least she got you food.
Yeah, right. Yeah, I used to get that too.
Comes in and my doctor goes, yeah, she's fine. That's normal. I'm the anomaly patient. So my family doctor is a white woman and she calls me her anomaly patient. She knows that when I come into the office, what she thinks is wrong with me is not what's wrong with me. And I'm going to make her work to figure out what's up with me.
I love these labels like anomaly, difficult patient. I get difficult sometimes. So yeah.
So I think we've all kind of experienced this maybe in the ER or like at our medical visits when we have our doctors have resident doctors in training and they always come in, want to take a look at.
Oh, don't even get me started on that. Don't even get me started on that. I've actually had pretty good fellows lately, but I had years where the fellows would come in and say something awful and then I'd be terrified and then the actual doctor would come in and be like, no, don't worry about it.
I went to the doctor, did blood work. Everything was normal. My doctor literally goes, that's surprisingly normal and healthy for a fat person.
What?
Yep. Yeah.
And that's just something that we really need to understand, especially in 2021, is that you can be overweight and you can still be healthy.
Yeah, they need to learn manners, and then B, bedside manners.
Yep.
Yeah, and I've been really underweight for my height and age and all. Like I had a really low BMI, and I would get blood work done. Yes, I did struggle with anemia, but other than that, there was nothing out of the ordinary. And I had EKGs and all the ECGs and all of this stuff done just to make sure that my heart is okay.
Mhm.
But it's true. Like it's sometimes I think what the chart and what they have on books is not always accurate when it comes to individual, because everyone's body is a different functioning and different stature, and all of that comes into effect. So we just can't go based on like you're in the normal percentile or you're in your low percentile. It's like the same thing with kids. What would you like others to know about your experience that is often misunderstood?
I think a big one in academia, especially in professional life, it's annoying. I get to be Black and educated. That's to put it frankly, I get to be Black and educated. And that's completely fine.
Mm-hmm.
The other thing is, I am not the Black woman's mouthpiece. I am my own mouthpiece, but I'm not the mouthpiece for the whole entire Black community. And that's not just from my perspective. I have a friend who's currently doing her master's, who the school that she's going to is highly racist. But she's doing a program where out of like 200 kids, maybe 20 are Black. And every time something ethnic related or Black community related come up in conversation, everybody in the class kind of goes, so what do you think? For those of you who are listening, I literally just flipped my hair over my face. Like I'm looking at somebody behind me. So what do you think? What's your opinion? What should we do? What can we do? How do we handle this? And she constantly feels like there's an extra pressure and extra stress on her to represent the whole entire Black community and be the whole entire Black voice within this education system. And you'll see for her in a lot of it where systematic racism comes in to play beautifully. Sarcasm, of course, those who didn't understand that. So we're not our community's mouthpiece, and we get to be individuals. Beyond that, I am not my skin either. I'm so much many other things than I am Black. I'm a woman. I'm a mom. I'm a Christian. There's so much more to me than I am Black. Lastly, I get to be Black and proud.
And I was going to say too, is that what we had last season when we did an episode on neurodiversity, and we had two people with different, on the autism spectrum and very different experiences. And what one of them said was, if you've met one person with autism, you've met one person with autism.
Autism, yep.
Yeah, so that you don't it's completely different. My experiences, even as a congenital heart disease survivor, as someone who has tetralogy of Fallot with absent pulmonary valve, which is a very complicated version of tetralogy of Fallot. So one of my best friends also has tetralogy of Fallot. He doesn't have absent pulmonary valve. We have had entirely different experiences, even though we have the same heart condition. So I can't even speak for others with tetralogy of Fallot. Recently, in fact, I had an acquaintance also who had tetralogy of Fallot, and he passed away at the age of 35 a few months ago. And, that was devastating because I have not seen anyone with my particular cardiac defect in my age range pass away. And that was very, very hard. But again, all of our experiences are different. We cannot speak. Yep. We cannot speak for others necessarily. We can advocate for others for sure, but we can't understand what it's like to walk a mile.
Well, and we can advocate for others based on our experiences navigating that system, right?
Yeah, exactly.
And yeah.
Sorry, I didn't mean to interrupt you.
No.
I was going to say, Sehdeen, what advice would you give to others for advocating for themselves as a Black woman what would you tell other Black women how to advocate for themselves? What's the best thing they can do?
I, as a Black woman, want to be treated just as how you would treat the next person beside me who's not a woman of color or a person of color in general. How would I advocate for yourself? Stick to your guns. You internally know how you are feeling, what's wrong with you, what's going on with you. You know you. And doctors are learning from a book, and you might not be textbook. Um, there's also a book by a Black doctor from the UK again, that he's looking up things like smallpox and chickenpox, what that looks like on a Black skin compared to what that looks like on somebody of a fair complexion or a white person. And sometimes it's very different. Keep going back, keep advocating for yourself. If something doesn't feel right, it doesn't feel right. And until you're at peace, do not allow anybody to tell you otherwise. That would be my best advice.
Do you feel that Black Lives Matter or similar types of organizations are inclusive to people with disabilities? And if not, how could they be more inclusive?
I don't follow the movement 100%. But I do believe they are inclusive of people with disability. I know we had an issue the other day with it was another person in the US, a mental health candidate who, again, has a disability, um, had sickle cell anemia, if I'm correct. I'm not 100% sure. But he had some blood issue that caused him to be horribly cold even in the middle of summer. So he's walking down the street dancing, and somebody called the cops on him. Wasn't doing anything out of the normal. And today he's now dead because somebody thought he looked out of place. So I believe they did advocate for him. His pictures was up, his hashtags were up. However, I feel like with everything going on with Black Lives, there's just too many hashtags. There's too many people to name, too many people to call attention to, that I myself can't even name all of them off the top of my head. I know I have a few that completely rocked my own world, and their names will forever, or even their stories, if I don't remember their names, will forever be itched into my brain for the rest of my life. But I think Black Lives are doing such an awesome job in what they do. Do I think they could do better, including people with disability? Absolutely. However, they're also fighting for people who are dying needlessly every day. And sometimes we can only fight one battle at a time. And I'm not sure the battle for us is yet to be fought. However, what is happening and what has been happening is a fight for Black women in the medical field. Because Black women die disproportionately faster and more than their counterparts when they go to deliver. It's more likely for a Black woman to go deliver and die that way. And in some cases, the same situation. It's just the opposite situation of our Black men. Police are killing our Black men like their target practice. Doctors are killing Black women like they're practicing how to do surgery for the first time. Sorry, my kid just turned off my light.
That's okay. That was actually a really perfect answer.
So you mentioned one thing, Sehdeen, and based on that, I want to ask you one more question, and feel free not to answer. As a Black woman and being a single mom, do you think you are portrayed or looked at differently when you are going out in public or going to doctor visits, or like if you're doing things with your son, or even when it comes to your son's health? I know right now it's COVID and we're quite isolated, but I just want to know if like you had any thoughts or experience with that.
So with my son, we actually spent 3 weeks in kids already, and another stint in Humber because of issues he was having. So do I notice a difference? Not really. I've never actually I can't say that because I've never been in the room with other people when they're being treated by doctors with their kids. Um, I know in the beginning, my son's pediatrician, God bless his heart, like the loveliest man. So he's like, "Is the dad involved?" And I'm like, "No." Explain to him the situation. He goes, "Oh well, then he's missing out. You're a lovely girl." And like he's the most chirpy man you'll ever meet.
Oh,
Um,
that's great.
so he has been completely amazing. Don't feel any different um,
Mm-hmm.
with him. He probably thinks I'm over concerned about certain things when it comes to my son. And he's just like, yeah, no, yeah, that's not something we're going to be worried about. He also calls me one of his easiest patients because usually I have no issues and no problems.
Mm-hmm.
Um, that can't be solved immediately. I am not like double thinking his care, anything like that. As well as with kids, I find that it's hard to pinpoint what's going on. Um,
Mm-hmm.
Again, mom gut, trust your gut. When my son ended up in sick kids, we had gone to the doctor twice before for him having diarrhea over
Mm-hmm.
about a month period. By the time we got to the end of it, it was just getting to the worst part, and Amir got super lethargic, etc., etc. And I literally just followed my gut. I had saw the doctor the Friday. This was a Saturday night.
Mm-hmm.
Um, Went to sick kids Saturday night, and they sent us home. I went back to sick kids on Sunday, and they admitted us for 3 weeks. So again, even with that, follow your gut. A lot of the times with kids, they will play it off like, oh, it's just diarrhea, it'll go away in 10 days, it's just a stomach flu. With my kid, it wasn't just a stomach flu. To this day, they still don't know what was wrong with him per se,
Mm-hmm. Mm-hmm.
just that we had about a 2-month period of vomiting and diarrhea. Um,
Mm-hmm.
it got to the point where he was having diarrhea 40, 50 times a day. Like one day I actually counted the diapers because I'm just like, no,
Yeah.
no.
Yeah.
Even with that, just as with you, Sarah, earlier, where you talked about the fact that they wanted to cover up the symptom,
Mm-hmm.
my son, it was the same thing. We wanted to treat the symptom, but I'm just like, what's wrong with him? What's wrong with him? Somebody got to tell me what is the issue.
Yeah.
Otherwise,
What's the cause and the root
yeah,
of the problem here? Yeah.
yeah. Otherwise, we can't, I'm not continuing with that course of treatment. It
Yeah.
got to the point where they wanted to put like a central line in his chest
Mm-hmm.
because they couldn't keep IV on him anywhere. And I'm just like, yeah, no, we're not going to do that. What we're going to do is we're going to keep him off the IV for a while. We have tried every single limb on him and he's blown every line. You guys cannot tell me what is wrong with him. We're not putting in a central line. And it ended up that me sticking to that and forcing them to actually give me formula to give to him and other food to give to him is what kind of helped him to recover. And by the end of that week, he was out of there. But there was like a 3-day period where they had him on IV food. And
Mm-hmm.
the IV food tends to be harsh in kids. It blew his hand, blew in his feet, both feet.
Yeah.
So it's the same thing. Whatever your gut says is what we're going with.
I
What
think, yeah, and you make a good point there, especially I think like I'm not a mom, but having my mom being part of my journey as a child, like from infancy, um and sometimes I think when it comes to the healthcare system, especially when you come from a colored background, they just feel like you're undermined in your mom's skills or your because you don't have English as a first language, you're not understood. Mind you, my mom can speak better English than I can. She's born here, but just because her physical appearance, they just feel like she's like not a good mom. And um, I think moms really they know their children best, and they need to stick up and fight for them and advocate for them when they are not able to. And I know my mom has had to do that quite a few times for me, and even in my early 20s when I've ended up in the emerge,
yeah,
because she's known me, she brought me up, she knows my pain tolerance, she knows all of that.
yeah. Um, and as for you, Jackie, coming into motherhood as well, it's stick to your guts. Like whatever your gut says, that's the law, that is the truth. Nothing else matter outside of what your gut tells you.
Well, I mean, to be honest, like, well, my mom, with the same, it's very similar to Sarah. Um, when I was born, right away, my mom said she's not breathing properly, and they were like, "Oh, she just needs to be suctioned." So they kept taking me off and kind of like doing suctioning, and then they would bring me back to my mom, and I would be like struggling to breathe. And finally, my mom's like, "No, something is wrong." And they took me away and then finally told her, yeah, no, you're right. Something is wrong. She's got a heart condition and she's got a 10% chance of surviving the night. And then it was like, well, obviously the most wonderful day of my mom's life turned into the most devastating day of my mom's life. But my mom was right. She stuck to her guns. And every time like they would bring me back to the hospital because I had pneumonia, it's just colic. It's just colic. She'll be fine. It was pneumonia. I was dying every single time. And even relatives didn't understand at the time. And they would come over, they'd be sick. And, you don't now with COVID, oh, God forbid, you never do that. But back in the day, nobody cared. So people would come over to my parents' house and they would have a cold. They gave it to me. It would turn into pneumonia. And then only when they would see later that I ended up in the hospital on oxygen, like clinging to life, I don't think I ever ended up on a ventilator from that, but they would realize that, oh, they weren't kidding. She's not well. And so, and like I had my mom still advocate for me until even when I got married for the first year, I had both my mom and my husband with me so that basically she could pass the torch over to him.
Yeah. And all the information that she has over to him. Yep.
Yeah. In fact, my parents had a meeting when they knew we were going to get engaged. My parents actually sat down with my husband and had a meeting with him where they explained everything with diagrams and charts.
I love it. I love the dedication.
Yeah. So they showed him like all these medical diagrams and everything. And they said, okay, this is what you need to look out for, blah, blah, blah. And they went through every little detail with him. And so now it's like, okay, well, they passed the torch to him. And now when I can't speak, he can advocate for me. But so Sehdeen, where can people go to find out more information on you?
So on Instagram, I'm at Sehdeen Unbridled or Sehdeen. You'll find my page there. I'll be posting new things like workouts and exercise and my new journey to loving me now as a mom and a single parent and going through that loveliness that I'm going through as well. I'm on 2 podcasts. I'll be dropping a new podcast later this month called The Glow Up with Sehdeen and Sash. That's between me and one of my best friends. We're both going through divorces together at one time. So we decided to tell the world about it and our glow up that will come out of this divorce season that we're going through. And Sehdeen Unbridled is my other podcast that I am by myself. If you want to hear more about my pregnancy journey, hop on over there. I'll be releasing an episode later on, like 2 or 3 weeks. By the time you hear this, it will be released. And you can hear more about it there and the loveliness of having comorbid mental health illness and all the other things that goes on in my life.
Yeah, no, it's really, really important. We got to wrap this up, but I thank you so much for coming on the show. We'll definitely have you on another show. Some really great perspectives that we heard today. And thank you, Sarah. I know you're still recovering from the accident. And thank you both for joining me today. This has been a really insightful conversation. Can't wait to get this out there and have more people hear it. Thanks everyone for listening and for watching, and we'll see you next time.
You've been listening to What's the Difference podcast. To hear all of our episodes or to watch our videos, visit whatsthedifferencepodcast.ca.